Hey everyone, so today we are going to talk anticonvulsants. So let's start. What is an anticonvulsant? Well, anticonvulsant drugs are also known as anti-seizure or anti-epileptic medications. They are taken for seizures, which are bursts of uncontrolled electrical activity between brain cells. So the way the brain works is there is chemoelectrical activity, that's electrochemical reactions, which cause us to think and function and have a nervous system. When there is a overreaction, either triggered by sensory stimuli, trauma, or a chemical imbalance, that's when a seizure occurs. So these can cause temporary abnormalities in muscle tone or movements. That could be stiffness, twitching, or limpness, problems with behaviors, sensations, or states of awareness. Now, epilepsy is a neurological disorder characterized by recurrent seizure activity, and epilepsy can be very dangerous, right? Because it's potentially fatal. Epilepsy is a very, it's categorized by having multiple seizures every day or every week, or having a general proclivity to having seizures. So seizures can also vary in appearance, intensity, and cause. So as you can see over there, that's what a typical, what we think of generally as a seizure looks like. It could be uncontrolled muscle spasmic movements ranging from slight to dramatic. Although there are other things called absent seizures, which basically looks like zoning out. A lot of times these seizures are actually misdiagnosed with kids because they just sort of look like the kid's maybe not paying attention for a second. But in fact, the child doesn't even know that they're having a seizure. They just sort of black out, they come to, and it's very often just diagnosed by these kids having problems with their classes, maybe keeping up with schoolwork or having a lack of focus in the classroom, when in fact they can't help it because their brain is just sort of malfunctioning. So now we have a few important notes for anticonvulsants, and you can see I put the auxiliary label on right there. Do not stop taking this medicine abruptly unless otherwise advised by your doctor. So as with many medications, if you stop taking them abruptly, you may have sort of rebound symptoms. So this may cause rebound or worsening seizures due to the sudden chemical imbalance in the brain if you were to stop taking them abruptly. Now, to change or stop taking an anticonvulsant, the dosage has to be tapered down slowly. So if your anticonvulsant is 50 milligrams a day, they'll bring it down to 25, to 10, to 0 over the course of weeks, instead of cutting cold turkey, which puts you more at risk for rebound seizures. Now, different anticonvulsants treat and prevent different or multiple types of seizures. You don't need to know what treats what for the exam, but just be aware that there are different types of seizures, like I said. Now, there are many anti-epileptic medications that have significant interactions with other drugs, so you should always inform the pharmacist when prompted about drug interactions related to an anticonvulsant medication, because the dosing is extremely precise, and even if the dosing is a little off, or they're taking a drug which may cause the dosing to be inadequate or to be too much, that could cause potential seizures and very serious complications for those patients. So never stop taking abruptly, and be aware that there are very many drug interactions. Now, a lot of these anticonvulsant drugs have what's called a narrow therapeutic index, or they are referred to as NTI drugs. Now, NTI drugs, this graph looks a lot scarier than it actually is. Basically, that 0 right there connotes the time when you take the drug, whether it's by mouth or if it's administered IV or what have you. The plasma concentration, that's the concentration of the drug in the person's bloodstream. And this axis, the x-axis, that's just time. So that's the amount of time. So say this is 0 hours. This could be 1 hour later, 2 hours, 3 hours, so on and so forth. Now, the way a drug works is you want to get it into what's called the therapeutic window. You want to get the concentration of the drug in the plasma to a point at which the drug becomes therapeutic and actually treats whatever disorder you want to treat. So whether it's pain relief, once like Tylenol gets into that therapeutic window, it's going to start treating the pain accurately and adequately. So the person's not going to be in pain for as long as that Tylenol concentration is within the therapeutic window. If it's a anti-seizure drug or an anticonvulsant drug, and it reaches that therapeutic window, that patient is very, very unlikely to have a seizure because the drug is at an adequate therapeutic dose and it's treating the potential for the seizure. Now, the peak of effect is that peak right there. And anywhere between this plasma concentration that's on the low end and this plasma concentration on the high end is considered therapeutic. If you go below this therapeutic window, you have what's called a subtherapeutic zone. So that's when normally you would retake your medication for the day. So a lot of drugs are dosed, so maybe you take them once a day. So your therapeutic window might last from 0 to 24 hours. After 24 hours, it dips down into that subtherapeutic range and the drug is no longer effective. You have to take your next dose so you stay adherent and you stay being treated for whatever the medication is treating. Now, if the therapeutic window goes too high, say you double up on a dose, or you're taking a drug which pushes your other anticonvulsant drug into a past where it should peak and into this red zone right here, that's when you get adverse responses. So you get side effects or overdoses. This is definitely where you do not want to be. You do not want to be on the other side of this curve. Now, narrow therapeutic index drugs have a very, very narrow therapeutic window, as you can see here. So you see this therapeutic window looks pretty big. Now imagine if it was a quarter of the size. Maybe it ends right here. You have to really carefully dose that drug because you have to hit the sweet spot for that peak effect in order for the drug to work and not cause any toxicity, but not be too low that it doesn't do anything. So what I was getting to with that, anticonvulsants, many of them are narrow therapeutic index drugs. Now, examples of anticonvulsants. And again, sorry for the disgusting picture. We have phenytoin, otherwise known as Dilantin. All oral dosage forms are NTI drugs, meaning they must be dosed very, very carefully in patients to prevent under or overdosing. Now, phenytoin interacts with many other drugs, so having a complete medication list from that patient is essential. And that includes not just their prescription medications, but any over-the-counter medications, any herbal supplements, teas, or whatever else they might be taking, even diet sometimes. Now, it has many side effects, including sleepiness and exhaustion. This makes sense, right? Because it works on the nervous system. So if it's working on the central nervous system, then it's going to affect the brain and it might cause changes in consciousness. But the other little strange side effect that really only happens with phenytoin and a few other drugs is called gingival hyperplasia, which is swollen gums, as you can see right there. It can also cause confusion and slurred speech, as well as hypersensitivity reactions like fever and rashes. Again, confusion and slurred speech, you can chalk it up to the drug working within the brain. We have phenobarbital as well, or luminol. It's less used today because phenytoin is preferred, but it's also a narrow therapeutic index drug. It's less used as well because it has a potential for abuse and dependence. It's a C4 drug because it's a barbiturate. So it's sedative and hypnotic, and that depresses the central nervous system, and that can lead to a high feeling, a coma, even death in large amounts due to respiratory depression, because especially if barbiturate drugs are taken with opiates or benzodiazepines, other things that might suppress the nervous system, you're going to have issues with problems and difficulty breathing, slowed heart rate, slowed breathing, and potential for cardiac arrest. Now, phenobarbital, however, is used mostly today for treatment-resistant seizures if the first medication the specialist tries doesn't work. So it's potentially, you're going to see phenobarbital if phenytoin doesn't work, for instance. Now, we have more examples of anticonvulsant drugs. This one's very, very common, valproic acid, which is depakine, and divalproic sodium, which is depakote. They're just two different salts of the same acid. Again, narrow therapeutic index drugs with a ton of drug interactions. Divalproex is another form of valproic acid, and it's also used to treat bipolar disorder. So once we get into the psych area, if you want to go to the psych video, you'll see valproic acid pop up again. We also have lamotrigine or Lamictal, and you can see that there's a little starter kit right there for Lamictal for patients taking valproate. So it's often paired with valproate to get a dual therapeutic effect. And the dose has to be carefully tapered up or down to prevent hypersensitivity reactions or serious rashes, or what's known as Stevens-Johnson syndrome. Stevens-Johnson syndrome is this very, very nasty and very deadly severe skin reaction, basically the whole skin, the whole epidermis falls off the body. It's extremely painful. It requires hospitalization, and it's fatal like 10% of the time. So we want to make sure that people on lamotrigine, again, are tapered up or tapered down to prevent those hypersensitivity reactions and lower as much as we can that chance for Stevens-Johnson syndrome or SJS. Now, lamotrigine, like valproic acid, is also used to treat bipolar disorder. That's just another reminder that these meds are working in the brain and they can have multiple uses. We also have levetiracetam or Keppra. That comes in a liquid, oral, and injectable dosage form, so it's very versatile. And side effects might include muscle weakness and fatigue, sleepiness, also increased irritability, mood swings, and even depression because it's working in the brain. Next, we have carbamazepine or Tegretol. Look at these, even more narrow therapeutic index NTI drugs. So again, sometimes used to treat bipolar disorder. We're seeing a trend here, right? Or nerve pain. Its side effects include nausea and vomiting, rash, dry mouth, and blurred vision. The big warning with carbamazepine are blood disorders. So there's this risk with carbamazepine, as you can see right here, of aplastic anemia. So basically, carbamazepine, if it's not dosed correctly, it can stop the body from producing enough red blood cells. That can cause people to be anemic. Also has a risk for Stevens-Johnson syndrome, though not as high as lamotrigine, Lamictal. So, but the main line is for the carbamazepine, we have lab monitoring required. So you got to monitor those blood tests if someone's taking carbamazepine to make sure that their blood levels are stable and doing well, and they can continue taking the medication. Now, another treatment, another anticonvulsant convulsant is oxcarbazepine, which is Trileptal, another NTI drug. Sometimes it's used to treat bipolar disorder or nerve pain. Side effects include sleepiness, and there's also a warning for SJS and hyponatremia. Hyponatremia is a low sodium, and that can cause seizures, coma, and death. So again, not common, of course. We wouldn't have these drugs on the market if that happened with every patient. But what is important to know is they should be monitoring for their sodium levels with those standard blood tests that you would be taking with these drugs. And again, a seizure specialist, a neurologist would be the one prescribing these at the correct levels. Next, we have topiramate, otherwise known as Topamax. I see this all the time. It decreases abnormal excitement in the brain like other anticonvulsants. So its side effects, again, they're typical for depression of the central nervous system and cause drowsiness, dizziness, and blurred vision. The main complaint I hear about topiramate is cognitive impairment, which is a trouble thinking clearly or quickly. Now, I had a professor in pharmacy school who talked about when she was taking topiramate, she's like, I had to stop taking it. It was just making me dumb. Like she had to stop taking it because it clouded her brain and she was having issues giving lectures. So thankfully, I'm not on topiramate when I finish doing this full 15-hour lecture series or however long it ends up taking. Anyway, it can cause nausea and diarrhea. Can cause loss of appetite and also weight loss. So sometimes people like topiramate because it actually makes them lose weight. So, I mean, of all the side effects you could have with medication, not the worst one. If you could stand to lose 5 or 10 pounds. I mean, you might not be able to think as clearly, but you'll be skinny. So whatever. So sometimes it's also used to treat migraine headaches as well. We have gabapentin. You'll recall from the analgesic lecture that it's a neurological drug. It works in the CNS, in the brain. And its side effects include, unlike topiramate, it includes weight gain as well as fluid retention. So you get peripheral edema. That's a fluid retention in your extremities, so hands and feet, especially in the legs. And it's also used to treat nerve pain and anxiety as well as seizures. And then we have pregabalin. Again, you'll recall from the analgesics lecture, that is a C5 or a Schedule 5 drug with addiction or abuse potential. Its side effects include weight gain, mild euphoria, drowsiness, and it's also used to treat nerve pain and anxiety. So that is all for anticonvulsant drugs today. As always, I'm Dr. Dominic DeFilippi. You can feel free to email me with any questions. Thank you.